Today's webinar is presented in partnership with the National Immigration Law Center. Shelby Gonzales, Director of Immigration Policy here at the Center on Budget and Policy Priorities, is joined by Gabrielle Lessard, Senior Policy Attorney at the National Immigration Law Center. They will provide an overview of immigration status-related eligibility requirements for Medicaid, Children's Health Insurance Program, and for enrollment in marketplace plans. And with that, I'll turn it over to Gabrielle.
Thanks, Gina. Sorry, folks, we're just waiting to get control of the slides. Okay, so I'm going to start by talking about eligibility for marketplace coverage. This is eligibility based on immigration status. People obviously have to meet other requirements in the case of the marketplace residency in order to be eligible. Now, you're going to see slides like this with a long list of immigration statuses. I don't plan to read through every one of these statuses, nor do I expect you to memorize them just by seeing them quickly here. This is really something that you can refer back to. So eligibility for the marketplace is based on being lawfully present. That includes a couple of different categories of immigrants. So lawful presence includes qualified immigrants, who I'll talk about in a minute, are people who are eligible for federally matched benefits. So most qualified immigrants are lawful permanent residents. That's also called people who have a green card. It's frequently abbreviated as LPR. Then there are a number of categories of people who are admitted to the United States for humanitarian reasons, including refugees, people granted asylum, certain Cuban and Haitian entrants, people who are paroled into the US for at least a year. That's not the same as criminal parole. It's a humanitarian status. And then certain people granted different kinds of administrative relief, as well as many battered spouses, their children, or for a child, their parent, and survivors of trafficking. Others include members of a federally recognized Indian tribe or American Indian who are born in Canada. Other lawfully present statuses include people who are granted relief under the Convention Against Torture, people with temporary protected status. There are a number of people with TPS in the United States that's temporary relief granted to people when something happens in their home country that makes it unsafe to return. Deferred enforced departure is similar to TPS. Deferred action is a kind of administrative relief from removal. Important to note that people who have deferred action for childhood arrivals, or DACA, are the only category of lawfully present immigrants who are not eligible for the marketplace. People paroled in for less than a year, people with many different non-immigrant visas, including U visas for victims of serious crimes, many people who are citizens of different Pacific Island nations, and then some other people with temporary orders. Lawful temporary residents and people with family unity are from old laws from 1986 and 2001, so you are unlikely to see any of those people. Now, some people who don't even have status yet are eligible for the marketplace. People who have applied for permanent resident status or asylum if they have work authorization, or if they're under 14 and have had an application pending for at least 6 months. People with who have applied for special immigrant juvenile status, which is for kids who have been abused or abandoned. People who have applied for victims of trafficking visas, or from relief from withholding of relief from deportation or removal. Now, people in addition to asylum applicants who are adults, other people who are applicants who are required to have employment authorization are applicants for TPS, people who are applying for registry, that's for people who've been here since 1972, not common, order of supervision, a status or a form of relief for people who cannot go back to their home country safely. Other people who applied for administrative relief from deportation, and then again, IRCA, that's a 1986 law. Life Act is a 2000 law, unlikely that you will see any of those people. Now we'll talk about eligibility for Medicaid and CHIP. So people who are lawfully present are eligible for the marketplace. There's a subset of lawfully present immigrants who were designated under laws passed in 1986 as qualified. That's a subset of lawfully present. Of course, in order to be eligible for Medicaid and CHIP, they have to also meet the residency and income requirements. So qualified immigrants, as I talked about on the previous slides, include lawful permanent residents, humanitarian entrants, and then some people who were admitted for different political reasons. Amerasians are the children of US soldiers from the Vietnam era conflict, not people you will commonly see anymore. Iraqi and Afghan special immigrant visas are for people who assisted the US primarily as interpreters during the wars in those countries. Only a small number of those visas are granted, but you may be more likely to see them. Withholding of deportation or removal, again, is administrative relief. Certain battered spouses and their children, or battered children and their parents, as well as trafficking survivors and their spouse, child, sibling, or parent. And then again, we have Native Americans born in Canada. One important thing to know about eligibility for Medicaid and CHIP is that there is a 5-year waiting period that's known as the 5-year bar. This primarily affects lawful permanent residents. The 5-year waiting period begins when the person obtains a qualified immigration status if they are physically present in the US at that time. Some people come into the United States as lawful permanent residents, so their 5 years would start when they actually entered the US. Now, there are a number of exceptions to the 5-year bar. One applies to people who were here in the US before the law that created that status or that distinction went into effect in 1996. Then humanitarian entrants, people who are refugees or people granted asylum, as well as people granted withholding of deportation or removal, are exempt, and they are not subject to that 5-year bar when they later become permanent residents. People who have come from Cuba or Haiti under certain laws, as well as Amerasian immigrants, if any of them are still within that status. People who, that's Afghan and Iraqi special immigrant visa holders, as well as trafficking survivors, members of the US military on active duty and their spouses and children, as well as veterans. And then there are certain state options, which I'll explain on the next slide. So states have flexibility to vary from the federal eligibility rules with respect to children and pregnant women. Within Medicaid and CHIP, states have the option to cover not only qualified, but lawfully residing children or pregnant women. This includes qualified immigrants without the 5-year bar. So it's essentially the same group of people who are eligible for marketplace coverage, the lawfully residing children and pregnant women. Now, 2/3 of states have taken up this option for children, and nearly half of states have done it for pregnant women. There is also a different option under CHIP for states to provide pregnant women medical services, such as prenatal care, regardless of their immigration status. And of course, these are the federal rules. States are able to use their own funds to cover people who are not federally eligible. So in my home state of California, we use state funds to cover lawful permanent residents during that 5-year bar period, as well as children and young adults, regardless of their immigration status. Now, Medicaid is available regardless of immigration status for limited emergency services. These are related to an emergency medical condition. It is available to all providers to cover the cost of medical services that are provided to people who meet the state's Medicaid eligibility rules, except for their immigration status. Important to know that the state defines what an emergency medical condition is within the parameters of the federal law. Now, this is available to people who have not yet met the 5-year bar, as well as people who are lawfully present but not qualified, including people who have temporary protected status, as well as people who have DACA and people who are undocumented. So here's an example of a mixed status family. Ricky and Ava are married and they have a daughter named Karina. Ricky became a lawful permanent resident 2 years ago. Ava is a naturalized US citizen. That is the term that's used to refer to a person who came to the US as an immigrant and later became a citizen. And then Karina was born here and she is a US citizen. So they're all applying for coverage. What coverage are they available to receive? Oops, I went too far, sorry. So Ricky's applying for coverage. He is not a citizen. He's a permanent resident. That makes him a qualified immigrant. However, he's subject to the 5-year bar. He's only been in permanent resident status for 2 years, so he has not satisfied the 5-year bar. But as a lawfully present immigrant, he is eligible to enroll through the marketplace into a qualified health plan. Ava is a citizen applying for coverage. There's no 5-year bar for citizens, obviously. So she may be eligible for Medicaid as well as a qualified health plan through the marketplace. And then Karina is a citizen applying for coverage, no 5-year bar again, and may be eligible for either Medicaid or CHIP since she's a child, as well as a qualified health plan through the marketplace. So I am now going to turn it over to Shelby to talk about some special rules.
Hi, everyone. Thanks for the moment while I was trying to get my technology working. I'm going to start by just thanking everybody for tuning in today to our webinar, and to thank Gabrielle and Milk's partnership on this webinar and so much of the work that we've been doing. So many thanks, Gabrielle. I'm going to talk a little bit about some important eligibility rules for families that include immigrants, especially related to the marketplace. Okay, there we go. So the first rule that I wanted to talk a little bit about is premium tax credit eligibility for individuals who meet the marketplace lawfully present status, which Gabrielle talked about, right? It's a broader definition than the more narrow and restrictive Medicaid and CHIP restriction that would look at only a subset of people who are lawfully present and allow for that group. So because the rules are different in terms of eligibility based off of immigration status between the marketplace and Medicaid, there has to be kind of a way for people who do not meet the more restrictive Medicaid and CHIP eligibility requirements to still be able to afford purchasing health coverage in the marketplace. And for that reason, when people were creating the ACA, they created a pathway for individuals who either maybe they might have incomes that are even below the federal poverty line, and they can still get premium tax credits. So this includes people, as Gabrielle was talking about, right? There's lawfully present is a big group, qualified immigrants is a smaller group. So some people who are in one of those statuses that are lawfully present, but not in one of the qualified immigration statuses, that group could go ahead and still become eligible for premium tax credits, even if their income is below the federal poverty level, or in some cases if they're in a state that has expanded Medicaid, for example, their income could be somewhere between that 100 and 138% of the federal poverty level, and still qualify for premium tax credits because they're ineligible for Medicaid based off of their immigration status. Another example of group of individuals who you might run into in this situation, there might be some individuals who are subject to that 5-year bar. So as Gabrielle was saying, most of the people who are in that group are lawful permanent residents, but maybe they haven't been here long enough, right? They haven't had that status long enough. So they have not met that 5-year bar requirement. They too could also have income either within the Medicaid range typically for people, or even income below the federal poverty line and still qualify for premium tax credits. So the bottom line here is that this is a very confusing policy. Because it really kind of runs counter to everything we kind of think about when we think about who's eligible for premium tax credits. We typically think about that income, 100% of the poverty line as being the income floor. And we typically think about if your income is in the Medicaid range, and that's where you go. So here's a specific group of people who that does not apply to them because they don't meet the very restrictive Medicaid eligibility requirements based off of immigration status. So I'm going to give you an example. We have Gina and Adnan, and they're a married couple, and they have a son named Sam. And Gina is from the Republic of Marshall Islands, which is a nation covered under the COFA agreement. Adnan entered the U.S. as a refugee 4 years ago, and he gained his lawful permanent resident status last year. Okay, Sam, their baby, is a U.S. citizen, and he's already enrolled in CHIP. So both Gina and Adnan are full-time college students and both work part-time jobs. They're going to be the applicants in this scenario, and their projected income will be just under $20,000 a year, which puts them at 90% of the federal poverty line. So first, let's look at Adnan. He is applying for coverage. He is not a citizen. He is a refugee, and he is also a lawful permanent resident, because both of those things can be true. And he is a qualified immigrant. He does meet that requirement for Medicaid eligibility. Is he subject to the 5-year bar? No. And the reason why is because he is a refugee. Even though he became a lawful permanent resident, that does not, he's still a refugee. And as a refugee, he is not subject to the 5-year bar. So he may qualify for, based off of immigration status, for Medicaid or for QHP enrollment in the marketplace. Now we'll look at Gina. She's applying for coverage. She is not a citizen. Her status is, we have it abbreviated here as COFA. She does not meet, that definition, that restrictive Medicaid eligibility definition that we refer to as qualified immigrant. And so it's not applicable whether or not the 5-year bar even matters, right? Because she's already not met the first piece. The first step is that you have to be a qualified immigrant, and she is not, right? And so she's not subject to the 5-year bar, but she is lawfully present. Her status, her immigration status, does meet the marketplace enrollment requirement. So she's not eligible based off of immigration status for Medicaid, but she is for qualified health plan enrollment. So let's look at more information, right? Let's factor in their income and see how this could play out for this family. Adnan is a lawful permanent resident, right? We know that he is a refugee. He's not subject to the 5-year bar. We know that he meets the eligibility requirement for Medicaid and CHIP. His household is household size of 3, and his income is $20,000, or $19,548, which puts him at FPL level, right? Oh, sorry. Okay. In this example, by the way, we're going to say that he is not eligible for Medicaid because we'll say that his state has not expanded Medicaid, and we'll also assume that his income is higher than the parent's eligibility, which generally that would be higher than the very low kind of thresholds that are available for parents' eligibility in traditional Medicaid. And then we'll look at premium tax credit eligibility. His income is below the 90% of the federal poverty line. He's not eligible for premium tax credits to help him offset the cost of marketplace coverage. you know, he's not one of the types of immigrants, right, that his immigration status does allow him to qualify for Medicaid. So he is not eligible for that special rule that I talked about. And now let's look at Gina. Gina, we're still, you know, in the same scenario here, where she's in a non-expansion state, but she doesn't meet the Medicaid or CHIP eligibility requirements, right? So, so none of the rest of the information under Medicaid and CHIP is applicable to her. For premium tax credits, she is eligible for premium tax credits, even though her income is below the federal poverty line, and that's because what makes her ineligible for Medicaid is her immigration status, but nonetheless, she does have an immigration status that qualifies her to enroll in the marketplace. So she's eligible for that special rule that would allow her to get premium tax credits to offset purchasing a marketplace plan, even though her income's below the poverty line. Next, let's talk about some special marketplace rules for seniors. So there are some seniors who are not eligible to get Medicare Part A without having to pay for the premium. And that is because to qualify for premium-free Medicare Part A, an individual has to have sufficient work history. They would have had to received or earned quarters of coverage is how we refer to the technical term, which basically you earn that quarter of coverage when you're paying into Social Security and Medicare payroll taxes for working full time. And, you know, so generally you get a quarter of coverage in a year. So, you know, if a person's like a single person, that's generally going to take them about 10 years of work history in the United States, having paid for, you know, those Social Security and Medicare payroll taxes. There are times when spouses credits might also come into play. So there are individuals who you know, they look at how much it's going to cost them to pay for Medicare Part A without, you know, when they have to pay that premium, and it might be unaffordable to them. So some seniors have been getting coverage instead through the marketplace. But, you know, it is kind of a tricky situation. And for individuals who may change their mind about that later, like they might, you know, be in a situation where, like, I don't know, they're just shy of some credits or something to that effect. Those are folks that really want to pay close attention to this decision and find out more about Medicare Part A. We're not going to get into too much detail. We're going to focus a little bit more on, you know, examples of when it might potentially make sense and what some things that people bump up against when they're thinking about if it makes sense to enroll in marketplace coverage. So we're going to go through an example of Lynn, and he is 74, and he lives with his daughter May and his grandson Michael. And Lynn has been a lawful permanent resident for 4 years. He's never worked in the United States. He receives $2,500 a year from a pension for work completed outside of the U.S. He is not enrolled in Medicare Part A. May is his daughter, right? And she provides more than 50% of her father's support, you know, for his expenses, all of his living expenses. She claims her father and her son as tax dependents, and the household's income is $43,440 a year, which is 200% of the federal poverty line. So Lynn is eligible for qualified health plan enrollment, right? He's a lawful permanent resident. He meets that requirement. He's eligible to enroll in a marketplace plan with subsidies, even though he's over 65, right? Which is unusual, right? This whole section is about unusual circumstances, right? Because he's not eligible for Medicare Part A based off of his work history. So traditionally, people over 65, that would give you pause, right, before they're going to enroll in a marketplace plan. That he's in the situation where he would have to pay a premium in order to get Medicare Part A. He has opted not to do that, and instead he's going to look at enrollment in the marketplace. So another question that kind of pops up when a scenario like this comes up is, a lot of times people will ask me, well, in this situation like Lynn, can he apply for his own PTC? In other words, can he decide that he's gonna, have his income of $4,300 that he gets from his pension be his income? And in this scenario, what they're proposing is that he then would claim his own tax exemption instead of his daughter May claiming him as a tax dependent, right? But if a person can be claimed as a tax dependent, they really need to indicate that when they're applying for PTC. And that would so what that would result in is that Lynn is May's tax dependent, so he cannot apply for a premium tax credit as a household of one. He may be eligible for PTC, but must include May and her income on his application for health coverage. If Lynn receives a PTC, May must file a tax return and reconcile that PTC on her return as well. To qualify for a premium tax credit, a couple requirements, right? One, you must say that you're going to reconcile, you're going to file taxes and you're going to reconcile that tax credit. Another attestation that you must make is that if you are married, you're going to be filing a joint tax return with your spouse. Now, we have a whole nother webinar that we did, I think it was last week, that talks about scenarios that might be outside of that traditional, general rule. I'm not going to go into that, but I recommend that you take a look at that. There's some exceptions for people who are going to get divorced, or people who who can file as head of household, and all those kinds of things. It gets very tricky very quickly. I'm not going to bore you right now with all those details, because I know that you can access that information someplace else. But it's important to know that there are some immigrants that, because of their immigration status, they must file a specific kind of tax form that is called a 1040 NR. And when that happens, some individuals are not able to file jointly with their spouse. So they would not be able to meet that joint filing requirement in order to claim the PTC. So it's really important to think about, whether or not this individual is able to make, when you're going through the application, if they're, making sure that yes, indeed, they are testing that they will be filing the taxes and reconciling the tax credit that they get, and if they're married, that they will be filing a joint tax return. And if they can't say yes to that, then that's a moment to pause and really be careful, right? You don't want them to be in the situation later when they can't fulfill the requirement that they said that they would when they were filing, when they were completing the application. State residency for marketplaces in Medicaid and CHIP. this question comes up, and it is relevant to immigrants. So it's important to kind of pause and find out whether or not the individuals that you're working with can claim residency when they're completing their applications. And the rules are very similar between qualified enrollment and qualified health plan enrollment to enroll in the marketplace, as well as Medicaid and CHIP. At least the general rules are very, very similar. Basically, if you intend to reside, even if you don't have a fixed address, right? But maybe you just moved to Virginia and you don't have an address yet. You're staying with your cousin until you find a place on your own. That's okay. You don't have to have a fixed address in order to say that you are intending to reside in Virginia, and that is okay. You could have entered also with a job commitment, or you're seeking employment, whether or not you're currently employed, and that also would allow you to meet the residency requirement in order to qualify for either marketplace, Medicaid, or CHIP enrollment in the state that you're in. To verify residency, states and marketplaces can accept self-attestation, and I think that's generally the practice in most states for Medicaid and CHIP, as well as the marketplace. And they can also use some electronic resources that the marketplace can. The same with Medicaid and CHIP. Some have been approved by Health and Human Services, Department of Health and Human Services. What they can't do is require that the person provides some type of immigration status evidence as the way to verify residency status. So that is not an option for states or for marketplaces. I'm going to turn it back over to Gabrielle to talk about other options for individuals to get insurance support, to get health coverage or health or medical assistance.
Thanks for bearing with me while I get control of the screen. Does not seem to have happened. Kyle, can you? Okay, thank you. So now I'm going to talk about some of the options that are available to people who are not considered lawfully present for purposes of the marketplace. And this includes both people who are undocumented as well as people who have DACA. So they can't buy health plans through the individual marketplace, even at full price. However, they can get employer-provided insurance. DACA recipients have employment authorization, so they can get coverage through their employer like anyone else. They can also purchase private coverage directly from an insurance company or broker outside of the marketplace. Now, many undocumented people do not have Social Security numbers, and many insurance brokers or companies have a misguided belief that Social Security numbers are required. They are not required. One of the ways that I point that out is by looking at the series of 1095 forms where people report that they have received coverage or been offered coverage. And that clearly shows that there's an option to enter a birth date for a person who doesn't have a Social Security number. People who are not eligible to purchase coverage through the marketplace for themselves can apply to get health coverage for their eligible family members. So think, for example, of an undocumented parent who has a citizen child, or a DACA parent who has a citizen child. The child can't apply for themselves, so they submit that application on behalf of the child. If they are applying to receive premium tax credits on behalf of that family member, they do need to file a tax return. And if they are not eligible for a Social Security number, there is an option to file a tax return using a different identification number that's called the Individual Taxpayer Identification Number. A person who is the household tax filer and who is looking for premium tax credit assistance does need to provide a Social Security number or ITIN on that application, even if they are not applying for themselves. However, they are not required ever to provide information about their immigration status. There are also some programs that are available to people regardless of their immigration status, including the assistance to pregnant women that I mentioned earlier, as well as the Medicaid payments for emergency services. In addition to those two programs, there are some programs that use federal healthcare block grants, including mental health, maternal and child health, family planning, communicable disease, and immunization programs that do not have immigration status requirements. Programs that are providing services that are necessary to protect life or safety also should not have immigration status requirements. That again includes emergency medical, as well as food or shelter like food banks, domestic violence shelters, mental health crisis services, crime victim assistance, and disaster relief services. Really important during this current time. Hospital financial assistance programs and charity care do not have immigration status requirements. And then community health centers, which include federally qualified health centers and migrant health centers, are available to everyone, as well as certain state-funded programs. Now, related to COVID, remember I said earlier that states define what is an emergency service under their emergency Medicaid programs. So a number of states have defined testing and treatment for COVID or symptoms of COVID as emergency services available regardless of immigration status under their emergency Medicaid programs. There have also been a series of federal COVID relief laws that include the two laws that created a private provider relief fund that reimbursed medical providers for expenses and lost revenue due to the pandemic, as well as federal funds that have been available to pay for testing and treatment for people who are uninsured regardless of their immigration status. Providers can't condition eligibility for their services on the person's immigration status or their ability to provide an SSN. However, under certain testing programs, the provider will ask for an SSN or other documentation in order to submit a request for reimbursement. You can still get that test if you don't have those things. There is an option for the provider to submit an affidavit saying that they requested that information. Okay, I'm going to turn it back over to Shelby here to talk about the application process.
Thank you. Okay. So, as many of you know, let's see. Oh, I'm trying to advance, but it's not working. Well, as many of you know that, being eligible for one of the benefit programs is kind of step number one, right? But then you also have to complete the application process, and that can sometimes be challenging. So we've identified some of the challenges that kind of come up sometimes for individuals who are immigrants or have members of their family that are immigrants. Sometimes it can get a little bit tricky. I am still not able to advance the slides, Kyle. Is there any way that you could go ahead and advance it for me? Because it says that I can, but it's not working. Thank you. Okay, so there are certain eligibility factors that must be verified in order for somebody to be enrolled or to stay enrolled in Marketplace or Medicaid or CHIP coverage. And citizenship and immigration status are included in that. And the way that works is that applicants provide their Social Security numbers or their immigration document numbers, in some cases both, if they have both. And then those numbers and other factors about them are electronically submitted to either the Social Security Administration and or the Department of Homeland Security, who they then can substantiate whether or not this individual meets the eligibility requirement for enrollment, right? So the Social Security Administration has the ability to, for an individual who is a U.S. Citizen, most U.S. citizens, the Social Security Administration can verify that that person is indeed a U.S. citizen based off of information collected in the application. It has a lot of trouble verifying U.S. citizenship for people who were not born in the United States. And that could include people who have gone through the naturalization process to become U.S. citizens. That could also include people who are derived citizens. So an example of derived citizen is an individual whose parents kind of open up that pathway for them to be U.S. citizens. So oftentimes actually my sister is a derived citizen. When she was a child, both my parents had become U.S. U.S. naturalized citizens. And since she was a child living in the U.S., was able, her citizenship was then derived. And oftentimes you'll hear about situations where like maybe people are living abroad, maybe they're on a work assignment or something, they're living in England and their baby's born out there, but they're U.S. citizens, their citizenship is derived. That can also be problematic for the Social Security Administration. So those are examples, naturalized citizens and some people whose citizenship was derived, older people, usually people older than 40, those are folks that might, be able to instead get their citizenship checked by the Department of Homeland Security instead. Otherwise, generally, the Department of Homeland Security, what they do in here in the application process is generally they're focused more on verifying the status of people who have a lawfully present immigration status, but they're not U.S. citizens, with some exceptions, right? There's some citizens too. I still can't advance, so thank you. So there's a lot of reasons why people might not have a successful electronic, verification of their citizenship status or their immigration status. And it doesn't mean that they aren't citizens or lawfully present immigrants. There are, some limitations to these data sources, and I just kind of explained one of them in the Social Security Administration's case, but there are some limitations that are similar on the Department of Homeland Security's database as well. So there are certain individuals who, despite they providing all the right information, like every little piece of information is, is exactly input correctly, it's just not going to work. And in those cases, they would just have to, they're going to be asked to submit some documentation instead to be able to get their status verified. Other times, there's human error that gets involved, right? There's a lot of information that's being collected on the application, and there could be typos, or there could be changes that people have experienced, like maybe they got married and they changed their last name, and it's just not close enough of a match anymore. So, the database isn't going to be able to substantiate the claim of either immigration status, an eligible immigration status, or citizenship. So there are both some limitations in the data sources as well as potential human errors that come into play. And when that happens, people will get in the marketplace, we call this a DMI, which is a data matching issue. There will be a pop-up that comes in the screen that says that eligibility is going to be temporary, and people can get benefits generally for just a little bit over 3 months you know, so they can, you know, they have that time to be able to submit documents to the marketplace to clarify, to, you know, clear up this data matching issue. Next slide. So to prevent a DMI, sometimes these are a couple steps that you can take. One is make sure that you made the right attestation, right? That's happened before. The questions are presented a little bit in a tricky way, at least they used to be. And what we're hearing is that they have new questions. So this year, you're gonna see the application look a little bit different in terms of how information is collected about citizenship and immigration status, and fingers crossed that it's a little bit clearer than what we've seen in the past. But I don't know, because I have not been able to see exactly how the questions are appearing on screen yet. So I'll be curious to hear what you guys experience. I would also then, you know, if you have a DMI, you can also make sure that all the document numbers that were requested from the applicants were provided. And if there was a name change, the application, you know, so the application is, the name that's been input into the application doesn't quite match up to the document, you can ask the person, so, you know, the names don't match up. Oftentimes they'll say, oh yeah, because I was married, I haven't updated my documents. Then there should be a place, at least there used to be in the application, where an individual can say that their name appears differently on their document, and then you can use that function. And again, like I said, I haven't seen the new application questions, so I'm assuming that there's still that kind of functionality. But again, that's something that I'll be super curious to hear if you all have. I think I was able to advance the slide. Yay. I'll be curious to hear from you all. These next two slides, we just basically are indicating what, you know, if a person has this type of status, or I mean, this type of immigration document, what information the application is going to be requesting that they provide in the application. So there's different numbers that different people get depending on, or are requested to provide depending on what kind of document they have. This again, since it depends on how the application is structured, they might change this a little bit. So again, this is something that we're looking forward to being able to see, you know, with time. And here's some additional document types and what information is, at least used to be, requested. Some of it's pretty straightforward, and I can't imagine that it will change. And then some of it, maybe it's either less or, you know, a slightly different number. The other thing I'll say is that when you look at the document numbers, it's tricky. There are a lot of numbers on these documents. It's not always super straightforward. So, and you know, what the application says, you know, please provide this number, isn't always how it's labeled in the document. So if you look at the first example up here, where you have what is, you know, this is a lawful permanent residence card. It's oftentimes referred to as a green card. Here they have what's called the USCIS number, and in the application they might say insert, and I hate using the word alien, but that was what the terminology was that was in the application previously. So, you know, for you as somebody who's helping somebody helping them enroll, you can see how that can be confusing, right? Because you don't necessarily know that USCIS number equals, you know, an alien registration number, right? So we have a resource that provides some tips that kind of tries to help you decode some of these things, so that you look for you know, which numbers. It helps you kind of see which numbers might be the numbers that are requested on the application, and help. So I won't bore you, but we will, you know, we have that on our website, and we'll make that available to you. And then other things to think about as people, you know, if they are asked to resolve a data matching issue, there are some specific requirements that the healthcare.gov application, I'm assuming that there's some specific requirements that also appear on state-based marketplaces, that they have some preferences in like the type of document that they will be able to, you know, accept for you to upload them. Also important for you to know is that when providing documents to prove citizenship, some documents can do that with just one piece of documentation, and that's oftentimes like a passport. But people who don't have a passport, oftentimes a US passport, oftentimes have to provide both something that proves their citizenship as well as something that proves their identity. So, you know, that's a little bit more tedious, right? So we have some examples of what that means. So here is, you know, a chart that shows what documents in it by themselves can prove US citizenship. And then in the cases where where the individual that you're helping does not have that and has to provide two documents, we have a table here that shows you, you know, what could meet that requirement. And important to note that providing two documents from the left-hand side is not going to be enough. It has to be one document from you know what we list here on the left, as well as one document from what we list here on the right side of this table. So you know, just important for you to keep in mind. The last thing I kind of want to mention is, you will recall that I talked about that special eligibility for people to be able to get premium tax credits, even though their income might be below the federal poverty line or otherwise in the Medicaid range. I just want to say that the application process can be quite challenging to get the right eligibility determination. And it really does depend on whether or not somebody has a DMI. Usually it's all, you know, kind of flows from there. So I'm not, because in the interest of time, I'm not going to go step by step through what this looks like, but enough to know that there are going to be some individuals where the marketplace thinks that, you know, this is a person who looks like they are Medicaid eligible, and they're going to send that person to the Medicaid agency, and that person will have to be denied Medicaid eligibility in order to, you know, based off of immigration status. And then we all know that that is a rocky road back to the marketplace, right? Like once somebody is sent to Medicaid, you know, you lose a lot of people along the pathway. So these are folks that are going to need some extra help, right? If you know, based off of what you know, it looks like this is an individual that fits that type of situation. They're probably somebody who's going to really need some upfront, like, okay, so, you know, well, one, is this somebody who's already been denied Medicaid based off of their immigration status? And that sometimes happens, right? Like they might even come to you by saying, I applied to Medicaid and I'm not eligible for Medicaid, so I want to see if I'm eligible for marketplace coverage. Well, that is a good start, right? If you know, you can find out, do you know why you were denied eligibility? And they might say, well, they said I didn't meet the immigration status, or you know, anyway. So that might be a helpful way to think about it. On the other side, there might be some individuals who the application might just think that this is a person who's in what we oftentimes refer to as a coverage gap. You know, in other words, the healthcare.gov, they can electronically verify the individual's immigration status through SAVE. Their income is below the federal poverty line. So it appears that they're not eligible for Medicaid based off of their income. sometimes the marketplace might ask for immigration documentation, and that would be important to follow through and provide that documentation. Sometimes they're not. Sometimes they're just told they're treated just as if they were in the coverage gap, and there's no more information provided, and that might be like a time when you have to pick up the phone and call the marketplace. And unlike, like I said, for most people, when they have a data matching issue, they are still going to be able to enroll in marketplace coverage, and they're still going to be able to access premium tax credits, and if they're eligible for them, right? These are individuals that when they have a DMI and the system thinks that they are somebody who's ineligible because the system thinks they're in the coverage gap, right? So they're not going to award them PTCs and CSRs during this time. So again, these are people who you're really going to want to help through the process so that they get the right eligibility determination. And we've provided kind of a flow chart on kind of the steps along the way so that you can take a look at them and see how you might be able to help them through that pathway. One of the steps in this path is for individuals who have been determined to be ineligible based off of their immigration status for Medicaid or CHIP, is to be able to indicate that. Again, like I said, there's been some adjustments to the application. I'm not sure exactly how this question is going to look in this year's application, but there should be a pathway for individuals who do run into that barrier, that have been asked to go to Medicaid and then come, get a denial. There should be some type of pathway that would recognize that some individuals need that information. And then again, we also provide the steps that occurs to people who have income below the federal poverty line, and they're not eligible based off for Medicaid based off of their immigration status, and what should happen, the steps that should happen for individuals that fall into that circumstance, and how you might be able to help them. And with that, I'm gonna just show you that we have a ton of resources here for you to look at, including some great resources from our partners at the National Immigration Law Center, as well as some resources on healthcare.gov. And I'll turn it back over to Gina. I'm sure that we have a bunch of questions.
Thanks, Shelby. So we have time for one question. So the question is, does the 5 years for the 5-year bar begin from the time that an individual gains permanently lawful status, or from the time they legally enter the U.S.? And similarly, if someone has DACA, does that 5 years begin when they enrolled with DACA or when they received a green card? Turn that to Gabrielle.
Sorry for the delay. The 5 years begin at the time the person becomes a qualified immigrant. So a DACA recipient is not a qualified immigrant. Their 5-year bar would begin at the time that they received lawful permanent resident status. Some people, again, do come in as lawful permanent residents. Some people do come in as refugees, Cuban Haitian migrants, or in other categories where they're qualified immigrants and also exempt from the 5-year bar. So in that case, they would not have to, they would be a qualified immigrant at the time they entered, but they wouldn't have that obstacle. And I can stay on if people are interested in staying on for additional questions.
That would be great. We do have a couple more questions we can ask. Individuals with tourist visas, would they not be eligible for PTC and CSR because they don't meet the residency requirement?
That's right. It's a condition of the tourist visa that you indicate that you intend to leave the country.
And how does someone with refugee status prove that they have refugee status in order to avoid the 5-year bar?
If you remember the picture of the green card, there's a category code on that card. The that category code would indicate that the person had been a refugee or had been granted asylum.
Great. And Kyle, if you can go back to slide 20, we have a question about that specific example. In this example, would the wife be able to enroll for coverage for her and her husband or only for herself?
So the wife is a COFA migrant, and I know we have a question about that. And she is only eligible for a qualified health plan. Her husband is eligible for either a qualified health plan or Medicaid. So for a qualified health plan, whoever is the primary taxpayer in the household submits the application on behalf of the household. So if the wife was the primary taxpayer, she would do it for both herself and her husband. If it was the husband, he would do it for himself and his family members.
And what I would add to that, and thank you, Gabrielle, what I would say is, Adnan is eligible. He's lawfully present. So he is eligible to purchase marketplace coverage. He's not eligible to get help paying for marketplace coverage because his income is below the federal poverty line. So his income is below 100% of the federal poverty line. He's not going to get PTC. He's not going to get premium tax credits. He's not going to get cost sharing reductions. So if the family could afford a pretty expensive plan for him to get covered, yeah, he can be part of the unit, but it's not going to, but he's just not going to be able to get subsidies to help him make it affordable.
Another follow-up question on the slide. Would the daughter be able to apply for a QHP with the dad as a dependent for health coverage for both of them, regardless of getting PTC and CSR?
I think that this is actually a question about Mai and Lynn. I'm trying to see the question. So the daughter, in this case, the father and the son are dependents of the daughter, and the daughter would be the primary taxpayer. So she would apply for coverage for the family, and then the family's availability of CSR and PTC would be based on her income and household size.
Thank you. And this question is actually about this slide. Well, for Adnan, because of his status, does he not qualify, and he doesn't qualify for PTC with his wife, does he have to apply separately for a plan?
So separate, I'm kind of confused. No, the marketplace application would be able to figure out the situation. They would just not award PTCs to the family. So they would award PTCs to offset the coverage for Gina, right? Am I getting the families correct?
Yeah.
But not for Adnan. So the application will be able to figure that piece out.
And we can take one last question. How do you assist immigrants who have zero income and don't file taxes, but have not met the 5-year LPR status?
In order to be eligible for the marketplace, people have to file taxes. So they would need to submit a tax return, even if they were exempt from tax filing because of their income, in order to be eligible to enroll.
Correct. In order to be eligible for premium tax credits.
Great, thank you both, and thank you everyone for your questions. So with that, as a reminder, we'll be distributing the materials from today's session via email, and we'll post everything to the Beyond the Basics website at www.healthreformbeyondthebasics. The next part of this webinar series is scheduled for next Tuesday, September 29th at 2 p.m. Eastern, 11 a.m. Pacific, and we will cover preventing and resolving data matching issues. You can register for upcoming webinars on the Beyond the Basics website under upcoming webinars. You can also find additional resources on the website, including reference charts, guides, and frequently asked questions. If you have questions or need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. Thank you again for joining us today.